You are a mom, and you probably have noticed that something changes in your partner emotionally and mentally every month. She's just moody. She's overwhelmed. You don't understand it, but you feel it. Or maybe you are a woman and suddenly you don't feel yourself. You are irritable, anxious, and feeling down. It's not just hormones, it might be something more serious. I'm Dr. Batista, a specialist psychiatrist. And this video is your guide to understanding what could be premenstrual dysphoric disorder and how science explains it. Premenstrual dysphoric disorder is a severe chronic medical condition that affects approximately 3 to 80% of menstruating women. Despite its prevalence, it is frequently misdiagnosed or dismissed. In this video, we will explore the science behind premenstrual dysphoric disorder, its symptoms, causes, and the available treatment options. Premenstrual dysphoric disorder is classified in the Diagnostic and Statistical Manual of Mental Disorder, 5th edition, DSM-5, under depressive disorder. Is characterized by severe emotional and physical symptoms that occur during the luteal phase of the menstrual cycle, the time between ovulation and the start of menstruation. The symptoms can include marked mood swings, irritability or anger, depressed mood or feelings of hopelessness, anxiety or tension, decreased interest in usual activities, difficulty concentrating, fatigue or low energy, changes in appetite, sleep disturbances, physical symptoms such as breast tenderness or bloating. These symptoms are severe enough to interfere with work, school, social activities, and relationships. The exact cause of this condition is not fully understood, but is believed to be related to hormonal changes during the menstrual cycle that affect serotonin levels in the brain. Risk factors may include a personal or family history of mood disorders, stress, and certain lifestyle factors. Diagnosing premenstrual dysphoric disorder involves tracking symptoms over at least 2 menstrual cycles to identify patterns. Now let's delve into the treatment options available for this condition. It's important to understand that managing it often requires a multifaceted approach combining both pharmacological and non-pharmacological strategies. Let me start with the pharmacological treatments. We prescribe selective serotonin reuptake inhibitors. These are considered the first line treatment for these conditions. Medications like fluoxetine, sertraline, paroxetine have shown efficacy in alleviating mood-related symptoms. These antidepressants can be administered continuously throughout the month or intermittently during the luteal phase, depending on individual needs and symptoms patterns. Hormonal therapies. For some, hormonal contraceptives, particularly those containing drospirenone and ethinyl estradiol, can help stabilize hormonal fluctuations that contribute to premenstrual dysphoric disorder symptoms. However, responses vary. and it's essential to consult with a healthcare provider to determine suitability. Diuretics and non-steroidal anti-inflammatory drugs are helpful as well. Gonadotropin releasing hormones agonist is used in severe treatment-resistant cases. These medications suppress ovarian hormone production. Due to potential side effects, they are not typically used as the first option, is the last option, and often combined with hormone replacement therapy. Let's go deep in non-pharmacological strategies. Cognitive behavioral therapy, CBT, can be beneficial in managing emotional symptoms by addressing negative thoughts patterns and promoting coping strategies. Techniques like mindfulness or yoga, even breathing techniques can alleviate symptoms. But what you can do? Lifestyle modifications such as regular physical activity, balanced diet, minimize caffeine and sodium consumption, adequate sleep and stress reduction is really the key. There are nutritional supplements. Some evidence suggests that calcium, magnesium, and vitamin B6 supplements may help reduce premenstrual dysphoric disorder symptoms. It's advisable to discuss, like I said, with the healthcare provider for the treatment. Treatment duration varies based on individual response. Some may experience relief within a few cycles, while others might require longer-term management. Regular follow-ups with a medical practitioner are crucial to assess effectiveness and make necessary adjustments. Patients treated for this condition should be assessed every 2 weeks during the follicular and luteal phases after commencing therapy and should continue to chart symptoms daily. If no change in symptoms occurs, an alternative therapy should be considered within 2 to 3 menstrual cycles. Remember, premenstrual dysphoric disorder is a legitimate medical condition and effective treatments are available. Seeking professional help is a vital step toward improved well-being. Thank you for watching. If you found this video informative, please like, share, and subscribe for more content of mental health and well-being. Let's continue the conversation and support each other in understanding conditions like this one. Thank you.